Hi, I'm Dana Hayden, a colorectal surgeon in Madison, Wisconsin, and I'm going to be telling you about what to expect during a colonoscopy. So first, once you get your colonoscopy scheduled, there's a few things you'll want to keep in mind. One, you can work the day before, as the bowel prep does not start until the evening before your procedure. Also, you just want to keep in mind that day before, even though you're working, you're going to only be drinking clear liquids, so you may be a little bit hungry. Secondly, you do need a ride home that day. So you can get to the procedure whatever way you want, but you do need someone to be there to be able to listen to the post-procedure instructions and also take you home, make sure you're doing fine and recovering okay. Unfortunately, rideshare services or cabs are not allowed. Some programs will have like a Medicar that could be set up, but that's pretty rare. So you just need to make sure that someone is there to bring you home. Now, as for the bowel prep, this is really the part of this entire experience that causes the most anxiety and confusion. The goal of the prep is to clear your entire colon out of all the poop. This allows for the procedure to be very accurate, allowing the endoscopist to see the entire colon. There are a variety of bowel preps, but all have the same goal. And each one will provide you a different amount of fluids to drink or pills to take, but all of them also require drinking a bunch of glasses of clear fluids to help the prep work. The timing of the prep is super important, and this is what we call the split dose. The split dose means that you're going to be taking half of the bowel prep the evening before, and the second half is going to be pretty early the next day. Now, the timing of it is very specific to when your procedure is scheduled. So if you have an early morning colonoscopy scheduled, usually you're going to start your prep around 4 to 6 p.m. the night before, and that's the first dose, and then drink tons of liquids that whole night, and then wake up very early, about 4 to 6 in the morning, and drink that second half. Okay, that is super important. Now, to make this a little bit more tolerable, it's very important to drink lots of fluids the entire day, but this can be a variety of things to drink. It doesn't have to be just plain water. You can drink flavored waters, electrolyte waters, any sort of clear liquids, broth, jello, popsicles, anything just allows you to kind of satiate that hunger a little bit and then also have a variety of things to drink. This prevents people from being dehydrated, feeling nauseated or headachy, so people tolerate the prep much better. The most important thing to remember is that you just cannot drink anything red or purple. This is going to stain the lining of that colon and makes visualization pretty difficult. Another tip is that if you tend towards constipation normally, starting a stool softener or laxative several days before and drinking more fluids will really be helpful. And then another tip would be avoiding any sort of salads, grains, high fiber, beans, fruits, and vegetables with lots of skins. Those are generally hard to clean out with the prep, so avoiding those for a few days before the procedure is also a real good idea. Next, the pre-procedure. So you show up that morning to the colonoscopy, you'll meet the nursing staff, they're gonna place an IV. The IV is to allow the anesthesia or the nurses to give you medications for sedation and for pain control. So generally people get sedation. The type of sedation is called twilight. This is when you're made to be sleepy and very comfortable during the procedure. Some people may wake up with this type of sedation, but the nurses will adjust and increase your medications as long as it's safe and make you more comfortable. Some people may just be zonked and sleep through the entire procedure just with a little bit of medication. There are a few brave souls that may not want to have any medications during that colonoscopy. Again, this is very rarely done, but some people just prefer to be awake the entire time. The procedure itself includes basically passing a long, thin camera through your anus to the very beginning of your colon. Now, the camera is very long, it's very thin, and there's a handpiece that has a bunch of buttons that allow us to flush fluids, take pictures, blow air, clean off the lens of the camera. So we pass this camera all the way to the beginning of the colon. Then we enter the very end of the small intestine, look around a little bit, and then slowly withdraw the scope. We look at the entire lining of the colon, and because there's lots of folds and corners, we go pretty slowly, taking our time to visualize as much as we can. Now, this is the other reason why the bowel prep is so important to clear your colon, because it gives us our best chance of visualizing every part of the colon lining. So what we're looking for during a colonoscopy is called a colon polyp. A polyp is just a growth from the colon wall. These are generally precancerous. They are in a bunch of different sizes and shapes, and how big or small or what orientation they are in is how we decide how we're going to remove these polyps. We pass a long wire with a tool at the very end of it. One can look like a little lasso, one can be a forceps, and we remove that polyp and we send it to pathology. Other things that can be found during the colonoscopy may be diverticulosis, which is little out pockets of the colon or weaknesses in the wall, or inflammation. These may or may not be biopsied. Once the scope is removed, you go to recovery, and then you'll be observed there for a little while. There are some risks that are associated with this procedure. Some include just not being able to complete the whole scope, either because we can't see very well, your stomach, heart, lungs, something isn't really cooperating, so we don't want to increase any risk of any complications. And some people have heard of horror stories that are related to what's called a bowel perforation or injuring the colon. Again, this can happen, but the chance of it happening is extremely low, less than 0.01% of the time for screening colonoscopies. These are risks that the endoscopist will tell you and discuss with you before and allow you to ask any questions about it. Now, once the procedure is done, you'll be moved into recovery and usually will be there for about 30 to 45 minutes. We want to make sure before you go that your vitals, like your heart rate and your blood pressure, are normal and that you're relatively awake and ready to go home. This is when the instructions will be provided and also a report showing you exactly what was done and what was found. Now, if your colon is clear, then the next colonoscopy may not be for 7 to 10 years if you're at average risk. And that also means that your bowel prep was good. If a polyp or polyps were found, then depending on the number of them and the pathology of them, that will determine when your next colonoscopy is. And then finally, if your bowel prep wasn't great, then we may want to repeat your colonoscopy sooner just to make sure nothing was missed during the colonoscopy. Now, people always want to know, if they haven't had a colonoscopy before, if it's painful. Well, I will say, after going through this myself, that it is definitively not. There is some discomfort associated with frequent loose stools during the bowel prep. However, besides that, people are generally comfortable and it is generally well tolerated by most people. I do not want to understate the importance of getting screened, especially with a colonoscopy, even with its inconvenience and some possible discomfort. I will say that people I see after they receive a clear colonoscopy report never have any regrets, and they feel so much better because of the peace of mind that they got. Now, even if something is found like a polyp or an early colon cancer, those patients are also so grateful to have undergone a colonoscopy, because that allowed us to prevent a colon cancer by removing that polyp, or find an early colon cancer that then can be cured. I know we can all do hard things. Some people think a colonoscopy is one of them, but the trade-off is invaluable.